So tell me about the article that you're presenting and why it's important.
Today, the article that I'm here for regards educational technology. We're also presenting the School of Health Professions and School of Nursing workload articles. This is really important, not just for faculty, but also for postdoctoral fellows, technicians, the people who work in our laboratories and our core facilities.
We are presenting the School of Nursing workload article. We have a few additions, modifications, and changes that we are going to propose today. One of them is class size. Another one is related to some new issues that came up over the past years related to different ways of doing clinical practicum. A few changes related to clarity. We have 4 different divisions in the School of Nursing, and sometimes the leaders on those divisions may not have adequate clarity to determine faculty workload. So hopefully it'll create better equity, standardization of how workload is calculated or looked at in the School of Nursing.
We're here to present a proposal to revise the workload article for the School of Health Professions.
We would like for our faculty to have more opportunities to work on scholarly publications so that they can reach promotion and reappointment guidelines that are valuable to us.
But it's very difficult to do that when only 10% of your workload is dedicated to scholarship. So we'd like to expand that so that we can have more opportunities to help grow the school.
We also have increased program sizes, so enrollment has increased, which we're very proud of, but we want to be able to have adequate workload to educate the future.
We've had a collaborative relationship with our administration for years, but as the expectations have changed, as we've been brought into the bigger Rutgers University, the expectations for faculty have continued to be the same. So we want to continue that collaborative effort so that we can meet the goals together.
And it's also important because it affects our future healthcare providers and how they care for our community.
So how did it go?
It was good, and there were a lot of good questions were asked. The Ed Tech article is relevant to the New Jersey Medical School Robert Wood Johnson merger into Rutgers because the accreditation requires that our curriculum be identical, and you have to use Ed Tech because we're on different campuses.
We had a very productive dialogue, exchanging our ideas with the administration. They had some very pointed questions for clarification, but we felt that they were understanding our discussions and our points.
We definitely felt that we were heard today.
There will be multiple follow-ups. We all have to keep our eyes open and our ears tuned.
There's more work to be done.